So prepare medications for one patient at a time. For accuracy, look at the medication administration record or MAR for one patient at a time. Obtain an ampule of the prescribed drug, and then compare the name, check the expiration date, and then the drug dose on the label of the ampule. If the dose differs from which it was ordered, calculate the correct amount to give to the patient, and then gather supplies and then perform hand hygiene. To prepare the injection, tap the top of the ampule until fluid moves out of the neck. Place a barrier, such as a small gauze pad, around the neck of the ampule and snap it quickly. I already draw back the plunger, then I will push it upward to eject the air without ejecting any of the medication. We check the level by holding the syringe vertically at eye level. And then, to remove bubbles, hold the syringe vertically and tap the side of the syringe to force bubbles to rise. Assuming that I used a filter needle, I will dispose it and replace the filter needle with a safety needle of appropriate size for the injection. I will recap the needle for safety precautions. Compare again the medication administration record with the label of the prepared drug. Label the syringe by putting the name of the medication and the amount contains. It is important to take these additional safety precautions anytime you draw up medication. Dispose used supplies, and then dispose the broken ampule in a leak-proof container. Then last is to perform hand hygiene. To prepare an injection from a vial, first to verify the healthcare provider's order or the medication order. And then when preparing medication, it is important to avoid being distracted. Select a vial of the prescribed drug, and this is assuming that this is the improvised vial and the prescribed drug according to the medication order. Compare the name of the drug on the label of the vial with the name in the medication administration record or MAR. So calculate the correct value to withdraw and double check your work. Remove the cap to expose the rubber seal. So assuming that this is a improvised vial, and then assuming that I already removed the cap to expose the rubber seal. Firmly wipe the surface of the rubber seal with an alcohol pad or a cotton ball. Select a syringe and attach a needle. So this is a 21 gauge syringe, and the 23 gauge syringe is not available for now. If the syringe is capped, remove the cap first. Pull back the plunger and draw a quantity of air equal to the volume of the medication you intend to withdraw from the vial. And then holding the vial on the flat surface, insert the tip of the needle through the center of the rubber seal, and then inject the air, and then inject the air you drew into the syringe into the air space of the vial. Hold the vial with your non-dominant hand, and then invert the vial, securing the plunger to continue counteracting pressure within the vial. Keeping the tip of the needle below the level of the fluid, and let the air pressure in the vial slowly force medication into the syringe. When the level of the medication in the syringe reaches the desired volume, position the tip of the needle within the air space of the vial. Tap the barrel of the syringe to dislodge any air bubbles. Next step is to remove the needle. And the needle up at eye level. Make sure to have the correct volume and no air bubbles. Make sure to label the syringe with the name of the medication and the dose in the syringe when preparing the medication away from the patient. When we open a multi-dose vial, write the date and your initials on the label, and then swab the rubber seal. So ma'am, I'm Nurse Jeremy and I will be your nurse for today. May I know your name and birthday po?
My name is Ruby Celestino. My birthday is September 17, 1980.
So ma'am, may mga allergies po ba kayo sa mga medications?
Wala naman.
Wala naman. So instruct the patient to report any itching or shortness of breath. Ma'am, let me know if kung may mga nararamdaman po kayong itchiness and shortness of breath, okay? So assume that I raise the bed to a comfortable working height, and then choose an injection site free from lesions and discoloration. So stretch the skin of the injection site, and then insert the needle slowly at a 5 to 15 degree angle until I feel resistance. As I slowly inject the medication, I should feel resistance. If don't, it's likely the needle is too deep. Withdraw it and begin the procedure again. So next step is to withdraw the needle, and then after withdrawing the needle, apply the safety cap. Gently wipe the site with a cotton ball or gauze pad and prevent to massage the area, or do not massage the area. Assuming that I activated the safety um, procedures, and dispose of the needle and syringe in a sharps container. So find out where the last injection given by asking the patient or checking the MAR. So ma'am, kailan po yung or saan po yung last injection niyo po? So determine which side you use and shift the patient's bed linen to expose the potential injection site. So ma'am, can I see your tummy now po? Pataas na. Inspect the area for bruising, inflammation, and edema. So the abdomen of the patient is free from inflammation, bruising, and edema po. If the skin is bruised or shows signs of infection, use different site. And then best site for subcutaneous injections are the outer aspect of the upper arm, which is this part, and then the abdomen from below the costal margin to the iliac crest, and then the anterior aspect of the thigh. These areas are easily accessible and large enough to allow multiple injections. Palpate the site and avoid any area that is tender or in which you feel a mass beneath the skin. So ma'am, so the abdomen of the patient is free from any masses, or um, do you feel tenderness, ma'am? Help the patient to find a comfortable position and ask her to relax the area you're about to inject. So ma'am, before I inject the medication, can you relax your abdomen po? So clean the injection site and begin at the center and move out in a 2-inch radius while cleaning in a circular pattern. Hold the syringe by using the thumb and forefinger of your dominant hand. And if the patient is of average size, hold the skin across the site or pinch a fold of skin with your non-dominant. Insert the needle quickly and firmly at a 45 to 90-degree angle. Now remove or withdraw the needle and apply gauze pad or a cotton ball. And do not massage again the area. Hold it for about 60 seconds. And then apply again the safety cap. If your patient is obese, pinch the skin and inject the needle below the tissue fold at a 90-degree angle and retain your grasp on the syringe to keep it still. Discard the needle and syringe in a puncture-proof container and remove gloves, and then perform again hand hygiene. Then document the injection immediately in the MAR. I will be giving the injection in the deltoid muscle, and it can hold about 1 to 2 millimeters of solution. We are going to use a 23 gauge of needle and have the patient sit or stand. And if your patient doesn't like needles, it is probably best to have them sit in case they passed out. So ma'am, can you sit now?
Yun lang.
Have the patient completely relax their arm. So ma'am, before I inject the medication, can you relax now for your arm? Is found high up where the shoulder is, where the shoulder is, and it comes out like a bony part of the shoulder. And I will use two fingers bit down, and this will be the injection site for the patient. Clean the injection site with an circular motion and start in the center. We're gonna use what's called a Z-track technique. It is now recommended for all IM injections or intramuscular injections. This technique decreases pain for the patient, but it helps prevent the solution that we're instilling from actually going in subcutaneous tissue. So by taking our non-dominant hand, we're just gonna go to the side of where an injection site is going to be and put a little bit of pressure, and we're just going to pull the skin to the side. For now, we're just gonna stretch the skin. Now we're going to take our dominant hand with an injection, and we're gonna in like we're shooting at a dart at a 90 degree angle. Hold it still and do it quickly to lessen the patient's pain, and hold it steady. And take our dominant hand to depress the plunger and instill that fluid slowly about over 5 seconds per milliliter. Take it out with the same angle we inserted it, and engage our safety, or apply the safety cap. Never recap a used needle. Then take a gauze pad to cover the area or cotton ball. Never massage the area because it can increase the solution go into the subcutaneous tissue. Then dispose the used syringe. Then perform hand hygiene. After performing hand hygiene, document what muscle you used on what side and how the patient responded, along with how much medication you instilled in that muscle.